Hello, and welcome to my presentation for the 2021 Research and Creative Achievement Conference. I am Marissa Ogar, a graduate student in the School of Health Sciences working towards my master's degree in athletic training. Today, I will be presenting on a case that I have handled at one of the 4 of my clinical experiences. Let's jump into the presentation. Ehlers-Danlos syndrome is a rare inherited condition that affects the connective tissues of the body, specifically the skin, blood vessels, bones, and organs. There are 13 subtypes of this disorder, but for this case, we are focusing on type 3, also known as hypermobility Ehlers-Danlos syndrome. This case is about a 13-year-old athlete who came into the athletic training room complaining of joint pain and swelling. She quickly disclosed her diagnosis of Ehlers-Danlos syndrome and explained that the pain and swelling happens every time she starts playing sports, but never this bad. The athlete also disclosed during a formal evaluation that she has recently graduated physical therapy and is no longer receiving their services. She was looking for my guidance about how to relieve her pain. At the conclusion of my evaluation, it was decided that due to her condition and pain, that she should sit out of running for the rest of the day. She was instructed to come back to the athletic training room the following day to begin an exercise program along with possible kinesiotape application to relieve the tension on her knees. The research was in favor of a maintenance exercise program similar to the one she was doing in physical therapy. There were 2 relevant studies that I found that I could keep in consideration when creating the maintenance program for this athlete. The evidence-based rationale for physical therapy treatment of children, adolescents, and adults diagnosed with joint hypermobility syndrome and/or hypermobile Ehlers-Danlos syndrome was a guide to provide healthcare professionals of the assessment and management of both those conditions. I took the following statements from the study into consideration when creating the maintenance program for my athletes. Musculoskeletal complaints are localized biomechanical compensations during activity. Most complaints of pain happen within 24 hours after activity. 65% are immediately after activity. Proprioception abnormalities can lead to musculoskeletal pain. Therefore, proprioception activities should be implemented in treatment plans. Ages 8 to 15 reported significantly poorer emotional functioning compared to healthy peers, specifically in the self-esteem category. Understanding the effects of the diagnosis on school, home, and social life is essential. Exercise program and other strength interventions can increase self-esteem overall. The second study, Musculoskeletal Conditions in the Pediatric Population with Ehlers-Danlos Syndrome, explored the most common conditions associated with Ehlers-Danlos Syndrome. The relevant information for my given athlete was that she fit 3 out of 4 of the most common categories within this systematic review. The 3 categories included the type of Ehlers-Danlos syndrome, hypermobile, most common diagnosed problem, laxity, instability, and pain, all of which my athlete had, and the part of the body involved, the knees, which also was applicable to my athlete. When creating the maintenance program, I also had to take into consideration that lacrosse was her main sport. The treatment that was implemented was 2 different exercise programs that switched each week and kinesiotaping technique that was a bilateral application to relieve the tension on her knees prior to each practice and competition. Below is the week 1 group of exercises that the athlete performed 3 times a week and the kinesiotaping technique applied. It's essential to have a conversation with your athlete prior to starting rehabilitation to create obtainable goals. The athlete's short-term goals were to decrease swelling, inflammation, and decrease pain. Her long-term goals were to prevent future flare-ups and increase strength for lacrosse season. In conclusion, this athlete is responding very well to the maintenance program and the kinesiotaping. She has more confidence while participating both track and field and lacrosse due to the kinesiotaping and an increased strength throughout her body. This athlete also has returned to physical therapy with with a more functional focus to ensure that these flare-ups do not happen again during her first high school lacrosse season that's coming up. The new goals that were created were to continue to gain strength and confidence, prevent activity-limiting Ehlers-Danlos related flare-ups, ensure the athlete is staying engaged in both athletic training room and physical therapy rehabilitation. Thank you.